We're just giving people a moment or two to sign in. We're still expecting a couple more people. Hello and welcome. I think we will begin now. So, welcome. My name is Elisa Grishman. I can't even say my own name. I am Elisa Grishman. I am a fat white woman with brown curly hair and a blue shirt with hearts on it. I am the founder of Access Mob Pittsburgh. We are a I'm so very sorry. We are a disability activist organization in the city of Pittsburgh, and we are bringing to you a series of community lecture series that have been funded by the Three Rivers Community Foundation. So thank you to them for their grant supporting us. And thank you to Disability Pride Pennsylvania for being our fiscal agent and helping us through all of this. Tonight, we welcome you. We have a slide up on the screen. In the top left corner, we have our logo, which in black and white has uh, the city of Pittsburgh buildings with a bridge in front. And then in yellow in front are a person in a wheelchair, a person with a white cane, and a person with a service animal. And in black and yellow on the bottom, it says Access Mob Pittsburgh. We'll start out with a little bit of housekeeping. Closed captions are available, and there is a link to the transcript in the chat. Please remain muted and have your cameras off during this presentation so that everyone can properly see and hear what's going on. If you have any problems, we do have the chat turned off for the most part for access issues for people who use screen readers. However, if you are having any sort of problem, you may send a message to Access Mob Pittsburgh Facilitator. If there is time at the end for a Q&A, please raise your hand, which for people on the web version and whatnot under React, there's a hand raise option. If you are on your phone, you will hit *9 to raise and or lower your hand. If you are having any problems or have questions about this, please contact Access Mob Pittsburgh Facilitator. But once you've raised your hand, wait to be called on. When it's your turn, you will be asked to unmute and or turn on your camera, which, there's the button that says audio. You can hit mute or unmute for that. If you're on your phone, you can hit *6 to unmute and mute yourself. And you don't have to turn on your camera. However, especially obviously if you're using ASL, you'll turn your camera on. Do be aware that everything is being recorded tonight, so especially in your questions and answers, you might not want to give too much personal information because this will be available as a recording. And you don't have to turn on your camera. If you'd like to ask a question privately and not have it connected to your name, if you send that question to Access Mob Pittsburgh Facilitator, they can read it for you. If we don't have time for questions, please email anything you have to accessmobpittsburgh@gmail.com. It is now my privilege to introduce Dr. Serena Lowe. Dr. Serena Lowe has spent the past 25 years furthering public policies that promote the socioeconomic advancement of low-income working families, individuals with disabilities, older adults, children, asylum seekers, and other at-risk populations. Serena has served in a variety of leadership roles in the fields of public policy reform, systems change, and commercial planning. Serena is the founder and principal at Enersys Strategies LLC and currently serves as a subject matter expert to several federal and state governments focused on systems change initiatives aimed at improving quality of life outcomes for individuals and with disabilities and through the provision of value-based high quality home and community-based services. I'm going to backtrack for a second. I'm so sorry. I realized that we had another slide to go on to from this. So in a moment, we'll have Serena talk. I'm so very sorry. Um, we just want to let you know that we have other events coming up under this community lecture series on Monday, January 27th, from 6 to 7:30. We're going to have a virtual only, so online only lecture called Ableism in Medicine: Is Representation the Solution We Need? There is a QR code to the side there for anyone who has their phone and wants to load the page. You can also go to accessmobpittsburgh.org, and on the top there is a drop down menu that says Community Lecture Series. You can find any of our upcoming lectures there. And then we're in the process of scheduling Monday, March 24th, community lecture. So topic is to be announced. Keep an eye out for that. And yeah, keep an eye out for that. And one last slide. To keep this lecture series running, we appreciate any and all donations that people can give. We have QR codes up for PayPal, Cash App, and Venmo. Please be sure to put AMP in the payment section so that the funds are directed to us. You can also go to accessmobpittsburgh.org/donate, and you will find our donation page there. And one final thing before I let Dr. Lowe go, you will be anyone who's attending via Zoom will be receiving a survey later tonight. Please, if you could just fill that out and let us know how we did, what we can do better in the future, we'd really appreciate that. I think that's everything. And now, without further ado, in some order of events, I welcome Dr. Lowe.
Thank you so much, Elisa and Access Mob of Pittsburgh. It's such a pleasure to be here this evening. I greatly appreciate the opportunity to be with you. I want to qualify that in my professional role, I have worked with all 50 states, including Pennsylvania, on a myriad of Medicaid services for home and community-based services and their waiver programs, but I am by no means an expert on Pennsylvania's waivers. What I'm going to show you tonight is information that is publicly available and show you where to find it and how to become even more conversant than you may already be about the different waivers and flexibilities that Pennsylvania has available to it to really help meet people where they are at and supporting them with what they need when they need it to be optimally independent and fully included in the community. So as I'm sharing my slides really quick, I want to, and bringing these up on the screen, want to describe myself physically. I am a 49-year-old woman. I have light brown hair and blue eyes. I am Caucasian. And yeah, I'm wearing like a light green sweater this evening. So really appreciate again being here. So again, tonight's focus is really to look at everything you need to know about Pennsylvania waiver programs. And that's probably embellishing a little bit because in reality, we're only going to have time to kind of give you the broad strokes. But I'm hoping to show you with some tools and some key information the distinctions and differences between each of these waiver authorities so that you feel a lot more confident and comfortable having conversations with people in and out of the system about what is available in terms of services and, again, flexibilities, more importantly than anything, to meet people where they are at. So this slide that we're on right now is titled Learning Objectives, and there's really two major learning objectives tonight, and then a possible third one that's not on here, but I'll talk about in a second in case we have additional time. So our learning objectives is to distinguish between various Medicaid waiver authorities that states can use to provide home and community-based services to individuals with disabilities. And the second learning objective is to learn what those functional eligibility requirements are to access these different authorities and services that are made available, because every waiver has a different set of services and different parameters around how and when those services can be provided. And it says for each of Pennsylvania's 9 waivers, and I should say that that's a little misleading. There are not 9 waivers, there are 9 home and community-based service programs. There are 7 Medicaid waivers where the federal government pays for some of it and your state government pays for some of it. In one of those waivers, there's 2 different programs because it's not confusing enough, right? 7 different programs. And then there is a waiver program that is completely state funded. And we're going to go through all of these. I will also let you know that in addition to the slide deck, we'll also make the content for tonight's program, which can be a little dense in terms of details. I'm going to make that available in a Microsoft Word document as well, so that you can have it and be able to read it on your own and digest it later, because there's a lot of details. So this next slide is entitled Medicaid Administration, and it just has some very basic bullets about the Medicaid program, just to make sure that we're all in the same place. Now, some of you have been working with Medicaid for years. It has been a critical part of your life or someone you love's life and world. And so you could write the book about Medicaid. And I'm going to ask you to be patient for the first few slides here, because I wanted to make sure that we all kind of have an even, we're at the kind of on the same page and an even amount of basic information about how Medicaid works. So Medicaid, which started in the 1930s and then was expanded in the 1960s, is a state and federal partnership. Federal government pays a certain amount to cover Medicaid programs in the state, and the states pay the remainder amount. When the program first started, states were paying the majority of funding that went into all services reimbursed by Medicaid. That has changed greatly in recent decades, and now the federal government in most states ends up paying more than 50% of the costs. So just so you understand how kind of it works, states administer the program on a day-to-day basis, and they have really broad guidelines set forth by a federal agency called the Centers for Medicare and Medicaid Services that they have to abide by. But remember, I said broad. They have a lot of flexibility in what kinds of programs they offer, what types of services they offer, and under what circumstances. Policies and programs, as a result, vary significantly from state to state, and each state operates under a CMS-approved state plan, which describes how the state administers its required services under the Medicaid program, including what individuals are covered, what services are provided, how are providers reimbursed, what those methodologies look like, and then what administrative activities the state is taking on. So as we head to the next slide, this next slide has what I would call like a colorful list, if you will, that really shows us what the key areas of Medicaid eligibility are for ways to access Medicaid long-term supports and services coverage. And there's a number of ways that you can do it. Some states require more than one of these, and other states, you just have to be eligible for one in order to get into the program. Number one, you could be qualify for supplemental security income, or what's known as SSI under Social Security. You could sometimes you have to meet certain income requirements and establish that you live under the poverty level. That's not the case in every state, but some states require that. You might need to establish criteria that demonstrate that you are medically needy or medically complex and require long-term supports and services. There is a pathway for children with significant disabilities known as the Katie Beckett pathway. And for those of you, that name might sound familiar, but you might not quite know where she's from in our history. Katie Beckett was the reason that we now have home and community-based services covered under Medicaid today, because her family and a group of families like her advocated in the late 1970s and early 1980s for coverage to support children with complex disabilities to be able to live in their homes and not be relegated to an institution or to a nursing home. There's also a program called the Medicaid buy-in. So in states that do say, look, even if you have a disability, in order to qualify for Medicaid, you still have to be below the poverty line. But let's say you're somebody who works and you have a disability, you may therefore not be eligible. So 46 states have created a way for you to buy into Medicaid, which is called the Medicaid buy-in program. It might be called something different in Pennsylvania, I'm not entirely sure, but it's the ability for, if you do not meet the income levels, like your income exceeds the cap that is set forth, you're able to actually pay a premium every month to get into the Medicaid program. Special income levels are sometimes there will be tiered special income levels based on disability status that you can exceed. And then there is what's known as Section 1915I State Plan Home and Community-Based Services. We're going to talk a little bit more about that. But this was a way for states to start covering more in-home and intensive community-based mental health services for individuals experiencing serious mental illness. So this next slide, I'm not going to spend a lot of time on it, but just to make clear, there are two different types of Medicaid services. There's mandatory services, which are in a state plan. And this slide is a chart form. It just lists in a couple of columns the different types of services. That doesn't matter where you live, every Medicaid system has to cover some of these services. However, the extent to which they cover them and how much they cover or how much they'll pay for these services is at the discretion of each state. And this is for all populations served under Medicaid. So anybody who qualifies for Medicaid has access to these services. Things like inpatient hospital services, laboratory or x-ray services, some outpatient hospital services. A couple of really important ones that are in here that I want to bring to your attention for the disability population is that there are nursing facility services that are in here, but you notice home and community-based services are not. And that is because there is what's called an institutional bias in our federal statute, which requires all state Medicaid programs to offer anyone who meets nursing home level of care to have access to a nursing home or institution, but does not require home and community-based services to be provided. So we'll talk more about that when we can, but I'm sure that infuriates you as much as it does me. There are two other services that are in here that sometimes are highly underutilized, but are really important to children, youth, and adults with disabilities at various points in your life. The first is known as early and periodic screening, diagnostic, and treatment services, which sounds like a lot, so we call it EPSDT. And these can pay for services like therapeutic supports, paraprofessionals, nurses for children and youth who need those services both in the home and during the school day. They can also be Medicaid funds can be leveraged with special education funds to support those services in the school system. Medicaid's a payer of last resort, so special education has to kick in first, and then where they cap off, Medicaid can kick in. Home health services is another one on here that's really important because it can oftentimes be used in spaces where, let's say you're in a waiver program and you don't normally need personal care assistance. So you're in a waiver that doesn't cover personal care assistance, but let's say you have an accident or you are ill or you have a surgery and you need temporary in-home care. Home health services will be offered to you under your state plan. So these are some important services that affect the whole population at one point or another, but they're particularly valuable for people with disabilities. Oftentimes, when you're in a Medicaid waiver program, no one ever talks to you about these other services, but these are services that are available to you anytime you need them under the state plan, and it's required in every single state. So that's why I wanted to bring those up today. We're going to skip that one and kind of go to the story. So just a quick refresher on Medicaid and home and community-based services. As I just mentioned to you, and by the way, this slide shows 4 different key points that we're going to cover. And the first one has kind of a little picture that's kind of to show like the capital of a state capital. And this is to say that, states are required to pay for long-term supports and services under institutions, but they're not required to pay for home and community-based services. So if you need long-term supports and services, you can get them in an institution right away. But in many states, depending on what your level of care is and what types of waivers services you need, you may be on a wait list for several weeks, months, or years before you actually have access to those waiver services. And a lot of this is dependent upon the state legislature and the state government, which is why I put the little capital here, because they really set the parameters on how many slots are available for each waiver program, how many waiver programs you have as a state, what services are going to be covered under those waiver programs, and how much they're going to pay for those services. So the second one is this fun little icon of like a flying dollar bill. And it says, again, that states don't have to pay for home and community-based services. The state can decide whether or not they want to put home and community-based services in their Medicaid programs. They can decide to only spend a certain amount of money on home and community-based services, even if that means some people don't get services. The third point, and this has a little clock because it says they can make waiting lists, as I mentioned. And this means that some people have to wait a long time before they can get home and community-based services. And when someone's on that wait list, they don't get services. Instead, they have to wait until their name comes up next on the list to get services. However, there is sometimes a lever or a flexibility that a state has where if your need is considered super urgent, like you are going to end up in a hospital or in a nursing home immediately if you are not provided home and community services, states do have an option oftentimes to elevate you to one of their available emergency slots. And that's something else that if you're taking notes tonight, you might want to point out and take a note, because a lot of people aren't aware that that is something that a state has a flexibility to do. And the fourth and final point on here, and this is a, what's it called when you turn the dial, like a sand thing, so like a sand timer. So when you turn a dial and the sand goes down, and when the sand goes to the bottom, your time is up. So that's what the little icon is here. And it says the same people get services in institution right away, but they want services in the community. So they stay on the wait list. And unfortunately, people wait oftentimes many, many years. Now we have federal civil rights laws that actually state that that states must provide federally funded services in the most integrated setting. And that is why so many states, including Pennsylvania, have been under what's known as Olmstead agreements in the past. It's based on the landmark Supreme Court agreement called Olmstead versus LC, which said that Title II of the Americans with Disabilities Act applies to services in the community, services in your home. And so that gives us the lever we need, even though the federal statute around Medicaid doesn't require states to provide home and community-based services. These civil rights statutes do, and they say you've got to provide people with just as many options to stay in the community as into a nursing home or an institution. And many of you, I'm sure, have been a part of that advocacy movement over the years, knowing Access Mob's amazing advocacy reputation. So this next slide is entitled, "What is meant by Medicaid-funded home and community-based services?" And it has kind of it's an infograph, if you will. It's a picture graph that has a large brown rectangle at the top, and it says, Medicaid has been paying for home and community-based services since the early 1980s, over 40 years. However, nobody decided what home and community-based services actually were. And that meant that Medicaid funding might be for home and community-based services. Well, it might have been going to places that said that they gave people services in the home and community, but actually operated a lot like institutions. So some places in the past that were receiving home and community-based service money would not let people with disabilities have people visit them, wouldn't let people the option to eat what they want, when they wanted to eat, did not give them the right to have visitors or friends outside of where they lived, or a boyfriend or girlfriend, did not let them go into the community or make friends outside the setting, and did not let them have personal control over their resources and environment. They were still institutions, but they got money meant for home and community-based services. And that really was not fair. So we're going to talk, remember when I said we might have time for a third conversation at some point about if we have time, I'd love to talk to you a little bit about the federal home and community-based service regulations so that you can be paying attention, for those of you that do receive waiver services, to make sure that they are being provided to you in a way that's truly home and community-based. Okay, so before we go here, I'm just going to stop for a second sharing and skedaddle around to, okay. Apologies, give me just a moment. I also just want to ask the moderator if we got just a pause to see if there's been any questions yet or comments from the group. Absolutely. And you'll definitely get them in Microsoft Word as well. All right, let me put back up my screen. Okay, go back to full. Oh, whoops, sorry. Apologies for that. Okay. So a little bit about state waivers programs and their design requirements. Anything that is considered a Medicaid-funded home and community-based service waiver has to do a number of things. And this slide is just kind of a list that lays out what waivers must have, what their requirements are, so that you kind of know generally. And then we're going to start dissecting the different types of waivers because each waiver is slightly different. So it's really important that you know this up front so that when we get into talking about the Pennsylvania waivers, you can see why certain waivers operate differently than others. So HCBS waivers, home and community-based service waiver programs, must demonstrate that providing waiver services won't cost more than providing these services in an institution. This is a really important requirement. In the past, this was not a problem, an issue, because institutional and nursing home services were so expensive. But since managed care has been involved in managing long-term supports and services for some time, those costs have gone down and shrunk, which means then the amount that home and community-based services has is capped as well, much lower than it used to be. Programs also must ensure the protection of people's health and welfare. They must provide adequate and reasonable provider standards to meet the needs of the targeted population. And they have to ensure that services follow an individualized and person-centered plan of care. States can waive certain Medicaid program requirements under HCBS waivers, and this includes 3 key areas. First off, state-wideness. This allows some states to target waivers to certain areas of the state where the need is greatest or where certain types of providers are available. This is actually really important for Pennsylvania because we're going to talk about a waiver that is actually relegated to only a certain location, couple of counties in Pennsylvania. And this is under what's called the 1902A. So this is a state plan waiver, okay? Comparability of services. So states can make certain services under, for example, a 1915I, which is a type of waiver, available to elderly or disabled individuals with specific needs and risk factors. For example, states could use this authority to target services to aging individuals, to technology-dependent children, to people with behavioral health conditions, or people with intellectual disabilities. And we've actually seen most 1915I waivers focus on people with behavioral health conditions because they are not a population that typically many states have 1915C waivers for. There's also the other area that states can be flexible on is with respect to income and resource rules. So states can provide Medicaid to people who would otherwise be eligible only in an institutional setting, often due to the income and resources that they have. So remember when I said to you, some states say that you have to meet the income level that anyone meets to not only be eligible for Medicaid, but Medicaid home and community-based services. And other states waive those requirements if you meet the medical eligibility criteria for waiver services. So this next slide says, it kind of gives you the differences and compares and contrasts the differences between a state plan amendment and a waiver. So state plan amendments are a mechanism by which states change administrative aspects of their Medicaid plan. And most of those proposals must comply with federal Medicaid requirements. They don't, though, have any cost or budget requirements, which makes that a really attractive thing. So like the 1915I, that option is a state plan amendment option. They do not expire once they're approved, but they can be altered through a subsequent state plan amendment, also known as a SPA. And they are for a specified period for CMS to approve and deny. Another type of state plan amendment you guys might have heard of in the past is an 1115. And we'll talk about those in a little bit. A couple of your HCBS programs blend an 1115 with a couple of waiver authorities because that, it wasn't confusing enough just to use one. But states are getting more mature and sophisticated in how they blend some of these different waivers and amendments in a way to maximize basically their reach and effectiveness. With Medicaid waivers, they're the mechanism by which states can waive certain requirements to test new methods of payment or service delivery. CMS has broad latitude around approval, but must be consistent with goals of the Medicaid. Waivers must be cost effective or cost neutral. And they are usually time limited. They're usually approved for 3 to 5 years, but can be renewed. And there's no required time frame for CMS review and decision. So sometimes it can take years. There was a waiver one time in the state of California that took 9 years to get approved because there was so much back and forth with CMS. So these are some of the state plan authorities that I wanted to share, and I misquoted 1115. That's not a state plan; it's a waiver. But these are state. This next slide just shows you again the descriptions of different state plan authorities. There's kind of 5 or 6 main authorities, and we're not going to go through all of these right now. But it's just to give you the reason I'm sharing these with you is to give you a sense of how complex creating and designing these home and community-based service programs can be, and why it's so hard then for an individual that needs to access services to navigate these programs and systems. So I'm just going to walk you through a very quick high-level description of these, and then we're going to get right into the stuff on Pennsylvania. So 1905A is the state plan provisions in the federal Medicaid statute. And there's a couple of different sections that allow states to cover home health care services, as we talked about, home health care aides, nursing. They also have the option to cover other additional therapeutic services for the entire population, including physical therapy, occupational therapy, speech pathology, audiology services. There's another section of 1905A that allows states to cover personal care services, but does not give beneficiaries using self-direction the authority to manage their own individual service budget. That can only be done through a waiver. 1959 we talked about. This allows states to offer people who need less than an institutional level of care, but still really need home and community-based services to do that. And that's why, again, a lot of the 1915 Is have been targeted towards people with behavioral health conditions because they may not meet the institutional level of care, but they certainly require intensive home and community-based services. Section 1915J is an authority that some states can use to allow for self-directed personal assistance services, which allows beneficiaries the ability to hire and fire and direct their own personal assistant or attendant, personal care attendant. And then Section 1915K is called the Community First Choice option. It was established with the Affordable Care Act, and it provides states with a 6% point increase in their federal medical assistance percentage, so their federal match that they get for HCBS attendant services. So some pretty cool flexibilities. Now I'll tell you that the most important ones for you to know is on this next slide. These are the Medicaid home and community-based service waiver options, and these are the ones that the state of Pennsylvania relies on the most. So Section 1915C is the most popular waiver option that all states take advantage of. There are over 300 active 1915C waivers throughout the country today, and Pennsylvania has 7 of them. At one point, Pennsylvania has had 11 of these approved, but 4 have been terminated. And we'll talk through what the current ones are shortly. But this allows states to cover a wide range of home and community-based services as a cost-effective alternative to institutional care. And states can forego certain Medicaid requirements. They can target certain benefits to specific populations. They can cap the number of beneficiaries who receive benefits, and they can create waiting lists for those who cannot be served under the cap. And Pennsylvania exercises all of those flexibilities. Section 1915B allows states to offer home and community-based services to people who need less than an institutional level of care. And states can also establish specific criteria for people to receive services under this authority. Now, this is important because Section 1915B is for managed long-term supports and services. So you have fee for service, and then you have managed care. And there are some states that started out, most of their 1915C started out fee for service, which means I complete a service, I bill the government or Medicaid as a provider, and I get a certain cost back. With 1915B, you can now actually change 1915C programs to be operated under managed care. And Pennsylvania has done that for some of its 1915C waivers, but not all of them. Like the intellectual and developmental disability targeted waivers are still fee for service under the state program. And then there's section 1115, which I brought up, which is a demonstration authority. It's very broad authority. It allows states to test new models to advance the goals of their program and to expand or pilot on an experimental basis the expansion of eligibility, provide services that aren't typically covered, or use innovative delivery methods. And it's also a very popular authority. So this next slide is a chart that shows you trends in state use of HCBS authorities. And what it says is that 1915C, 47 states in 2022 were using 1915C. And as I said, there's over 300 active 1915C waivers. Section 1115, there's 13 states that are operating Section 1115s. There are 14 states operating 1915Is and 9 states operating 1915Ks. And the reason I shared all of those other all those other state plan authorities with you is because many of those, the state of Pennsylvania has not yet chosen to exercise those. So those might be interesting vehicles for you as advocates to think about speaking to the state about in the future. If you wanted to expand different programs and create greater access or improved access to services for various people with disabilities. I think we're going to skip this for now. This is just another slide talking about current trends and Medicaid utilization and financing, but I really want us to get into the meat of the work that we have. So one thing I will tell you is because we only had 90 minutes together, I won't have time to go through all of the different specifics, but in your slide deck, you will have, and this shows you an example, this slide I have is called the 1905 State Plan Authorities, and it says mandatory benefits. I've created slides in here, and it will also be in the Microsoft Word document, a list for each authority of every benefit that is available and what those benefits look like, and also the statutory code next to them, so that you can go, and if you want to do a little deeper digging or dive into some of these, that you're able to do that. And I did that with every single state plan authority and every single waiver authority. I talk about who gets covered, what the guidelines are, what the application and approval process is, so that you have that background for your future advocacy efforts. Because, you know, this isn't a one and done thing. It's not just about understanding, protecting, and preserving the waiver programs and options you have today, but it's about thinking strategically about where you want your system to be in the future and what new ideas you want to put forth to your state leadership. So those are all in here. There's about 10 of those informational slides, again, dissected by each of the federal authorities. So now we're getting into the meat of the Pennsylvania ones. Oh, I don't know why it keeps doing that. Excuse me for a minute. Let me just get right here. Nope. Having some slides issues. I apologize for that. Sometimes slides are, okay, here we go. All right. So now we're going to look through Pennsylvania's Medicaid home and community-based service policies. This is just a kind of a background slide again about the fact that there are several waivers in the state of Pennsylvania that are available to various people with disabilities. They target different populations and they have different eligibility requirements, as well as offering a variety of services. They also have a certain number of available slots. And when those slots are full, a waiting list becomes open and people get on the waiting list. And it's in chronological order of application. So this slide shows you kind of your system in a nutshell. There are 7 major home and community-based service waiver programs. There's the Pennsylvania Adult Autism Waiver, plus there's a program called ACAP, which we'll talk about. And that's the waiver that is relegated just to a certain geography in the state of Pennsylvania. And it also supports adults in the community with autism. Then there's Pennsylvania Community Health Choices Waiver. There's the Pennsylvania Community Living Waiver. There's the Pennsylvania Consolidated Waiver, the Pennsylvania Medicaid Waiver for infants, toddlers, and families, the Pennsylvania OBRA Waiver, and the Pennsylvania Person Family Directed Support Waiver, also known as the PFDS Waiver. And each of these in this slide, there is in parentheses, a code, like a number. And that number is the number that the federal government has given this Medicaid waiver application. So if you have the name and number of this waiver, you can find out anything at any time about this online. And I'm going to show you how to do that. There is also, in addition to this, there is another home and community-based service program that is a state-funded waiver, and it's called Act 150. And we're going to talk about that one as well. Okay, so we're going to take each one of these one at a time. And what I'm going to do, every single slide from the next 8 slides is a chart. And the chart is going to show you the name and that code I told you about for the waiver. It's going to tell you what waiver authority your state uses to fund this waiver and what it's designed in. It's going to tell you the original date it was approved, its most recent effective date, and the expiration date. These are very important, and this, I'll tell you why I put those in a second. It's basically because every waiver, remember, is 3 to 5 years. When it gets close to a waiver coming up for expiration, like a year out, your state starts thinking about ways it's going to modify that waiver when it submits its application for renewal. And it has to go through an extensive public comment process. This is your opportunity as advocates to get in there early and often and talk about changes that you want to see made into the waiver before it's renewed. Then in the chart is the list of the functional eligibility requirements. So who the target population is, what eligibility requirements you have to meet, and all of the services that are provided in this waiver. And it's a snapshot. They're snapshots of what each waiver is. But what I've done and what you'll have in the document is a full link to each of these waiver applications online. So when you click the link, you will be able to go straight to the CMS website and see the most recent application that your state had approved by CMS that lays out all the specifics around each of these services, the parameters by which it's covered, etc. So for those of you that really want to nerd out and get really deep into a certain waiver, or let's say you're shopping around and you're not sure you're on the right waiver for you. Maybe you were young when you got on one waiver, and now that you're getting older, you think maybe another waiver has more services that align with your current needs. So this is your opportunity to kind of take a look and see what the differences are in waivers. So the first one is the adult autism waiver. And the state has 2 different programs, the adult autism waiver program and the ACAP. And the eligibility requirements are essentially the same. You have to be 21 or older you have to be diagnosed with autism spectrum disorder, and you have to meet intermediate care facility level of care or institutional level of care. This is a 1915C, and it was originally approved in 2008, but the most recent effective dates was July of 2021, and it will expire at the end of June of 2026, which means this summer, coming summer 2025, your state is going to be revisiting this waiver, which is an excellent time for those that are impacted by this waiver to submit comments and really try to actively engage in any redesigning or amendments or improvements to the waiver. There's a number of services: assistive technology, behavioral health services, community inclusion, community transition services, counseling, day and residential habilitation, environmental modifications, like to your home or your van or transportation, family counseling and training, job assessment and findings, nutritional consultation, occupational therapy, respite, speech and language therapy, supported employment, supports coordination, temporary crisis services, and transitional work services. So there's a lot of services in here for adults with autism. The Adult Community Autism Program, also known as ACAP, is the second program in Pennsylvania that's specifically designed to help adults with autism spectrum disorder participate in their communities in the way that they want based upon their identified needs. The difference is that ACAP is a managed care program, and it only serves about 200 adults in Dauphin, Lancaster, Cumberland, and Chester counties. So remember what I told you, that there are certain waiver programs and state plan programs that are designed that you can actually target it to a specific region. This is what they've done. I believe ACAP might be a 1915 BC, but I think it lies within your state's 1115. So there isn't as much information on this one because it actually is not very transparent online or on CMS's system. But this is what I've been able to find for you. You must be 21 years or older, diagnosis of autism spectrum disorder, requiring institutional level of care. You need to be able to live in a home or community setting without 16 hours or more per day of awake staffing and supervision. So if you need 17 hours or more per day of staff and supervision, then you don't qualify for the ACAP. And you must not have behaviors that are dangerous to yourself or others that could cause harm to property. I guess that's another requirement of this particular pilot. And there's a number of services. You can have physician services, psychiatric services, nursing facility, hospice services, dental, vision, speech, podiatry, chiropractic services, medical supplies and equipment, health promotion and disease prevention services, targeted case management, mental health crisis intervention services, which doesn't make any sense to me since they're restricting people with behaviors that are dangerous to themselves or others. So it's a bit of a contradiction between the services they provide and their eligibility requirements on this one. And unfortunately, I don't really know the rationale behind that. They also offer adult day habilitation services, homemaker services, residential and behavioral supports, respite care, supported employment, community transition services, environmental modifications, assistive technology, and family counseling. So slightly different from the adults with autism waiver, but some overlapping services and supports. Okay, the next one is, and please let me know if I'm going too fast. I just want to make sure I'm catching this. This is another chart, and we're going to go through this, and this is for the community living waiver. And the community living waiver, the authority number is 1486.R01.00. And again, you would only need that if you were looking it up by number, but you can also look it up by its name, which is the community living waiver. This waiver is a managed care waiver. It's under the 1915 B4 authority. And anytime you see B, you know managed care is involved. It was originally approved in 2017. Its most recent period is that it started January 1 of 2023, and it will expire in December of 2027. There's no age limit under this waiver, and it is specifically for people with intellectual disability or autism. It is also available for people with developmental disability with a high probability of resulting in an intellectual disability or autism, and they are eligible from age 0 through 8. They require, anybody that's on it must require an institutional level of care. They also have a cap on this, which says that your individual cost limit per year is $70,000. And the only service that's excluded from that is the services related to support coordination. So like the hours that you have a support coordinator helping you with your plan, your individualized service plan, that doesn't count against the cap. There's all kinds of services that are available. There's employment services, including job finding and job coaching. There's in-home and community support. There's companionship support. You can pay for companionship, community participation support, respite services, shift nursing, number of therapies, occupational therapy, physical therapy, speech therapy, recreational therapy, behavioral supports, assistive technology, home and vehicle accessibility adaptations, transportation, life sharing, and supported living. And life sharing is my understanding is kind of like a residential support service where you're living kind of on your own, but you might be sharing staff with someone else that's living nearby or next to you. And supported living is, I think, up to 3 people living in the same area and sharing support staff as well in a home-like setting. The next one is the consolidated waiver. And this is a 1915C, so it's fee for service. There's no managed care involved. It's been around since 1990. It's one of your older waivers, and it started in January 2023, and it also expires, just like the community living waiver, at the end of 2027. It's very similar in eligibility from the community living waiver that we just discussed, in that there's no age limit for anyone who has an ID, an intellectual disability or autism. If you have a developmental disability and you've got a high probability of acquiring an intellectual disability or autism, then you're eligible between ages 0 through 8. You have to require institutional level of care. The difference in this one, though, from the last waiver we just talked about, is that there's no individual cost limit per year on services. So there's no budget cap, which is great. So services range from residential rehabilitation, employment services, in-home and community supports. Pretty much everything that we talked about in the last one is included in here. The additional ones is, again, the residential rehabilitation, which is kind of group home model. And there's additional transportation services, I think, covered in the consolidated waiver as well. For infants, toddlers, and families waiver, this is a waiver for children between birth and age 3 that are in need of early intervention services and meet the level of care for an institution. It is a 1915C waiver. It was established in 1998, and the most recent version became effective in July of 2021 and will expire at the end of 2026. So this is another one to have on your radar screen as advocates, that the state will be beginning to work on the renewal process starting probably as recent as summer of 2025. Now, the services here is habilitation. It's a service provided in home and in community-based settings, and it's intended to assist the child in acquiring, maintaining, and improving self-help, domestic socialization, and adaptive skills. The other important thing is, remember when we talked about EPSDT services, or what is it? ESPDT, early screening, prevention, diagnostic, and treatment services. Don't forget that those are also state plan services eligible that any child in your state is eligible for. And a child that's on the waiver can also qualify for EPSDT at the same time. They can be leveraged to make sure the individual, the child, and their family have true wraparound supports and continuity in care. And that is something that very few support coordinators or case managers will tell you. And so you need to ask for those things. And it's very important to ask, like, what is our eligibility for EPSDT versus the waiver? Can we get some services from both? It's also important to understand from a provider perspective, because if you have a provider you like and you can only get them from either the waiver or EPSDT, you're going to want to have that information up front before you make a decision on which avenue to go or how to leverage these various supports. Okay, we're coming down to, I think, the last couple of ones. Community Health Choices Waiver. This is your largest waiver in terms of population. You have more people on this waiver than anybody else. And this is also one of the most complicated. It is a managed care waiver. So you have groups like EPMC, I think you have like Keystone, I think Centene is in there. You've got, I can't remember the other ones, but you've got like 4 or 5 healthcare plans that manage this waiver on behalf of the state. The requirements are that you have to be age 21 or older with a physical disability. You have to meet nursing home level or nursing facility level of care criteria. And you are desiring to receive long-term services and supports in your own home or in a community setting. This has been around since the early 2000s, and the most recent waiver went into effect in 2020, and it expires this December. So your state has been working on amending it throughout the course of the year, and my understanding is they are relatively on track to go into effect with a new 4 years on this in January. There are a number of services that are provided, including daily living services, assistive technology, environmental adaptations, cognitive rehabilitation therapy, employment services, home delivered meals, transportation services, personal assistance services. This is really important. It is the #1 service that people desire when they go into this waiver. It's also one of the most expensive of the services. Pest eradication and respite services. There are many, many other services that CHC offers. And there is a benefits package, and I've put the link in here, and it will be in the document, the full link, that provides you more information about how you can customize this waiver to meet other service needs that are not listed here. But these are the main services that people usually try to acquire. And again, it's a managed care situation. So you go through, you get assessed, it spits out like the number of hours that you might be eligible for personal assistance services and what other services you need. And then you work with your managed care team and your service coordinator to arrange your supports and supports plan. The OBRA waiver is a 1915C waiver. It's for persons with developmental physical disabilities. The disability results in at least 3 substantial functional limitations to activities of daily living. Your disability had to have been acquired before age 22. You have to be over the age of 18. The disability is expected to continue indefinitely and requires institutional level of care. And the services that you can receive are a host of daily living services to support activities of daily living, environmental adaptations, assistive technology, community integration services, respite services, transportation, supported employment services, and pre-vocational and educational services. This is one of your oldest, this is one of your oldest waivers. It started in 1991, and the most recent one went into effect in July of 2021, and it is also set to expire in June of 2026. So it is a third waiver for you to have on your radar as advocates that will be coming up probably sometime next summer. Your state will start to put out requests for information and start putting proposals out publicly about any changes that they're planning to propose in the renewal process. Great. Perfect. Well, and I'm probably going to wrap it up in the next couple of slides because I think this is the last waiver, the seventh and last waiver, and then we have to talk about the state-funded waiver. And then, so we're right on schedule. So the person family directed support waiver, also known as the PFDS waiver, is a 1915C again, so it's fee for service. It's not managed care. There's no age limit for intellectual disability or autism. Similar to some of the other waivers we talked about, developmental disability, the high probability of resulting in an ID or autism may also be eligible if you're applying between ages 0 and 8. You have to require institutional level of care. The individual cost limit or budget cap is much less for this one. It's $33,000 a year. And one of the differences about this waiver is that it is a self-directed waiver. So families choose to direct their supports, hire and fire and manage their staff. And so it gives a lot more flexibility, but it also has about only half of the annual budget per year. That budget cap excludes any time that you spend with a sports coordinator or supports broker. And there are some exceptions for employment services too. So maybe some job coaching or job development might be outside the budget cap, which is great. In home, and so I want to just mention this. You notice how how your state has thought about its numerous flexibilities here. And so they have a really, big differential between the budget cap that's on this one and the budget cap that I believe is on the consolidated waiver, but they don't have any budget caps on the other waivers at all, right? So again, it's interesting for you to know as advocates the differences in how the state has prioritized funding, how it's designed some of the requirements pertaining to each waivers. And it is totally appropriate as you start to dig into these a little deeper to ask why. Like, why is there a budget limit on certain waivers and not others? Why are there certain services like personal attendant services covered in the community choice, healthy choices waiver, but not others? I mean, these are the kinds of questions that hopefully looking and better understanding the distinctions and differences between these waivers is starting to foster in your mind, because they're excellent questions. And sometimes there's really good reasons why the state has designed it the way it is. And other times there's no reason at all. Or the reason might be that one target population yelled louder or advocated louder for certain things than other populations. So it's important to understand these differences and to ask questions. One of the important things that this waiver provides is shift nursing. And I really want to applaud Pennsylvania for having at least one waiver where there's flexibility in shift nursing. A lot of times people need personal duty nursing or shift nursing in their home, but they may not need 24/7. Some states are actually requiring them to present a 24/7 need to get even 1 hour. So it's good that there's at least one waiver that allows some shift nursing in one's home. There's the therapies are allowed in here, community participation support again, in-home and community supports, assistive technology. So all of those similar services, but I just wanted to highlight that that's in here. And I think the reason a lot of people, you might think, well, why would anyone go for this and not maybe one that didn't have any budget cap? Well, if you have very specific needs and you're living at home and you don't want to do traditional provider service route, okay, you want to be in control of who you're hiring, who you're bringing into your home, how you're managing those hours. This gives you a whole lot of flexibility as the beneficiary. So for you and your family. So this is why, so people are willing to, accept the cap, even though it's really, really low, in order to have that built-in flexibility and have more control and autonomy over the people providing the services. All right, this is the last one we're going to cover. And I understand from some of our leaders here tonight that that a lot of people have never heard of this service. And it's probably because it's a state funded program, which means they don't spend any federal funding on this program. And it is called Act 150 Services. It offers only 3 types of services: personal assistance services, personal emergency response systems, and service coordination. So to be eligible, you have to be, of course, a resident of Pennsylvania. You have to meet level of care for skilled nursing facility and be between the ages of 18 and 59. You have to be capable of basically self-direction. So directing your own care, hiring, firing, supervising attendant care workers, managing your own financial affairs, managing your own legal affairs. And you have to have a medically determinable physical impairment that is expected to last for a continuous period of not less than 12 calendar months, and might just continue to go. To take advantage of this program, you may have to pay a minimal copayment depending on your income. And so you have to go through an income assessment, but it doesn't make you completely ineligible. It just says if you exceed the income eligibility, then you have to pay into it, similarly to if you buy into your Medicaid program. And again, this is separate and distinct from Medicaid. And I wanted to make sure that people had the contact information for how they can get more information about this program. I anticipate the reason many of you haven't heard about it is probably because, since it's a state funded program, it's probably not an overly well funded program. And maybe they don't have the budgetary resources at the state level to do a lot of advertising or outreach. I mean, it could be a number of reasons, but I think it's really important, particularly for people who want to go down the self-direction route, need personal assistance services, and that's like the bulk of what you need. This might be a really good route and option for you to pursue. And don't quote me on this, but I believe it's statewide. There's nothing to suggest, other than being a Pennsylvania resident, that you have to live somewhere specifically in a certain part of the state. So hopefully that's some good information for you all to have. So I would love to maybe stop at this point, and would love to maybe just, ask a few questions. I don't of you all. I don't know if we can, I guess we probably couldn't do this today, but I would just say, since we don't have access to the chat, but I want you to think about, before today, how much did you know about Medicare waiver policies? And then who might you talk to or who did you first learn about Medicaid policies from before? And it's really important to share with Access Mom if this information was valuable. I know it's really dense, but I have to tell you, when this information is affecting your daily life, you cannot avoid not getting into the weeds. I mean, you have to get into the weeds on this stuff. And you have to educate yourselves because the system is not going to do it for you. There's a capacity issue, there's a volume issue, and systems are just not really good at educating and informing beneficiaries of what their options are and what might be in their best interests. So even though we have supports coordinators and case managers and care coordinators, and many of them work extremely hard out there, and if you have a good one, hold on to them for dear life because it's rare to have one for a really long period of time. But you can't even rely on them. You have to educate yourself. Your family has to educate themselves to really make sure that you have the information you need to make the best decision possible for you and to get as many of the resources and services you need to support you in, building your good life, your vision of a good life. So I think I'm going to just stop there. I'd love to talk at some point about the HCBS regulation. Happy to come back some other time. But I just want to kind of stop here and pause. And I would love to hear your reactions, any questions that you have or comments. Um, so I'm all yours and I'm happy to stay however long
Audio now
people want to
unmuted.
stay.
Zoom meeting. Open chat panel. Alt plus H button.
So I see a message from Rich in the chat that says if a person has declining health, is past the age of 70 or 75, can they get a personal assistant to come in and check on them periodically if they live alone?
The answer is yes. And I would say without, I obviously can't provide you individual guidance, but I personally think that the community health choices waiver would be the waiver that I would look at. I would also look at well, you wouldn't qualify for the Act 150 if you're in your 70s, but you absolutely could I'm looking right now. I think you could potentially qualify for the OBRA waiver, but the community health choices waiver, I think, is your best bet. Number one, I don't believe that I could be wrong, but I don't believe there's a wait list for community health choices waiver in your state, which is great because there are wait lists for like some of the IDD waivers and autism waivers. But for the community health choices waiver, I don't believe that there is a wait list. I'm going to double check that while we talk. So Rich, and you would meet all the qualifications, I believe, if you have a physical disability, you're over the age of 21, you wish to receive supports in your home, and personal assistance services are allowed. I think if you don't meet institutional or nursing home level of care, that would be the one area where you may not qualify. However, you could qualify then for state plan services for home care, or I'm sorry, for home health care under your state plan, which is something that's available to anyone. And you could, like, I don't know if you're under managed care right now, you could seek that out through a care coordinator and explain to them what's going on and see if you can get assessed for maybe someone to come in, however many hours a day or week you think you need to have someone come in to check in on you. So if you don't qualify for that community health choices waiver, I would look at speaking to someone about your state plan, home health care services, and that benefit.
Hello. I just wanted to very quickly confirm some things you said about Act 150. I'm a long-term participant on the Act 150 system. It is a buy-in. It is statewide. It is extremely difficult to get on Act 150 these days. because everybody who could possibly be shunted into the community health choices program was kind of shoved that way. Um, I have very minimal assets saved, but that's what kept me in Act 150, and the reason I chose to stay there when I could qualify for community health choices with a little bit of a spend down was because of Act 150 being um, a program that's guaranteed by an act of legislation. I felt like it was a more protected service in these politically uncertain times. I know if you're willing to come back and do a second session with us, Dr. Lowe, I'd really like to talk about how to protect Pennsylvania's very robust service system in the coming uncertainty of the political climate.
Thank you so much, Brenda, for sharing that like personal perspective on Act 150. I think, you know, again, I'm just telling you what's out there publicly, but to
Right.
have that lived expertise, you know, confirming some of the details around it, and just a reality check that, you know, it's hard to get in, is important for people to hear that are on the presentation. And I'm always happy to come back upon invitation and brainstorm with this group.
I think you need to unmute them.
Yep,
Okay, there
sorry.
you go.
It just took me a minute. My name is Kelly Barrett, and I am Miss Wheelchair Pennsylvania 2025, and my platform for this year is actually carrying on the legacy of the Olmstead Act and strengthening Pennsylvania's home and community-based services. So I would be interested to talk with you more, you know, offline. And hopefully, if you could come back again and speak more about Pennsylvania's waiver services, because there is a lot that Pennsylvania offers. I'm a participant in the community health choices waiver myself, but there's a lot of things that I think you stated that even the administration might be shocked at hearing that that should be the way that it would work. So just definitely having more knowledge to be able to utilize our services to thrive instead of just survive, as I say, because they're so important to living our lives to the greatest extent possible. So thank you for being here, and I just look forward to learning more from you in the future.
Yeah, thanks so much. You know, Pennsylvania has had a long history of, especially within ODP, in developing some really innovative waiver programs. I think that it likely has had growing pains like many states have, who have tried to transition slowly, and I will say slowly and intentionally, certain waiver populations into a managed care realm. You know, I also spent a short time in managed care for about 2 years and in MLTSS to understand within the belly of the beast, so to speak, how this was working. And so I think there's a lot of lessons learned. And I also think that there are some, you know, relatively new state plan options that came out, you know, in that kind of 2014 to 2016 timeframe with the passage of the Affordable Care Act, namely 1959, 1915K, that Pennsylvania has not considered yet, or maybe they are in the process of designing a 1915 I or K, but they haven't gotten that off the ground yet. And those could have some really promising, those could be additional promising opportunities for the state to expand upon what it already has in place. So happy to continue. I did want to go back and just say that in terms of the wait list, I don't believe, I'm not able to 100% confirm, but I don't believe that anyone that is on the Community Health Choices waiver, that there's a wait list right now. I think most of them are connected into managed care. There's usually a cap across the board for those programs. And so the managed care companies manage those costs and plans according to whatever they've established or negotiated with the state Medicaid agency in their annual contracts. But there are 13,000 people in Pennsylvania on wait lists for one or more of the IDD and autism specific waivers. And it looks like you guys have a pretty big anti-waitlist campaign going on in your state. So just wanted to clarify that. Yeah, sounds great.
Okay, well, thank you so much. Thank you, Dr. Lowe. This was incredible. We got a couple of offline comments saying, wow, she's great. So, the fact that people want you back, we might have to have you back. For everyone who attended tonight, thank you so much for being here. I know that that was a lot and very dense. Thankfully, this whole thing has been recorded to YouTube. There should be a link to that in the chat, and I'll be sending everyone who attended tonight, because I have your emails from the registration stuff. I'll be sending out an email as soon as this is done. It will have the survey. It will have a link to the video. Brenda, it sounds like you're comfortable with having I'll text you afterwards. It sounds like you're comfortable having your email address given out for talking about that one waiver. Dr. Lowe, are you comfortable with us giving out your email address?
I am.
Okay.
Please feel free to reach out to me.
Okay, I'll be giving that out. For people watching this after the fact on YouTube, if you contact accessmobpittsburgh@gmail.com, amongst other things, so Dr. Lowe said that she would be sending the slides and in the Word document and whatnot. You can email accessmobpittsburgh@gmail.com. We will happily send you all of this information. Just send us an email letting us know that that's what you want. Once again, thank you everyone for coming. Can you put the slide up again, Debbie, with the next event? So once again, our next event is on Monday, January 27th at 6 p.m. Ableism in Medicine is Representation, the Solution We Need. Our own board member, Monica's Albert Still, will be giving this talk, potentially with a guest. We'll see. And then Monday, March 24th from 6 to 7:30, we'll be having another lecture night. We have a guest lined up. We're just finalizing all that. And, especially for those of us who joined our mailing list, thank you for that. You'll be getting emails about that, or you can follow on our website, accessmobpga or pittsburgh.org. And then final slide, please. Oh, I love technology. There we go. Thank you. We run on donations, so, thank you to anyone who is able to, and if not, we understand, but we accept donations on PayPal, Cash App, and Venmo. You can either do it using the links there, or you can go to our website at accessmobpittsburgh.org/donate. Yeah, that's it. Access Mob would really like to thank, especially our board members, Debbie Cherry, Donna and Seppa Holmes, Kendra Vaughn, and Monica Albert Still. We'd like to thank Katie Rose for being our amazing tech person tonight. Thank you to Megan and Charity for doing interpreting. And especially thank you to the Three Rivers Community Foundation, whose grant is helping support us and the work that we're doing. And many thanks to Disability Pride Pennsylvania, our wonderful fiscal agent. I am Elisa Grishman, and I hope everyone has a happy and safe holiday season. Be good to each other.